We are following breaking news right now. Former First Lady Rosalynn Carter has been diagnosed with dementia.
Yeah, the Carter Center just making this announcement on their Twitter page. Rosalynn is 95 years old and, of course, the wife of former President Jimmy Carter, who is currently in hospice care at 98 years old. They live together in Plains, Georgia. The couple has 4 children and 22 grandchildren and great-grandchildren. Now, of course, dementia is a condition that really affects your overall health and mental health. Experts say 1 in 10 older Americans have the disease.
Yeah, think about it as brain disease, exactly. Rosalynn Carter wears many hats: wife, mother, partner, and a longtime advocate. She has dedicated much of her life to improving the lives of those around her and those with dementia in her home state and of Georgia and beyond.
Yeah, and that includes her efforts, of course, as a champion for mental health research since the 70s, really pushing for improved access to care and decreased stigma about issues surrounding mental health, which was so important, especially before a time that a lot of these things were talked about. 11 Alive Cheryl Preheim has more.
Driving onto the campus of Georgia Southwestern State University, the scene is calm, peaceful. Buildings, beautiful landscapes all meet your eye. Many may be surprised to know that it's home to a special institute that has helped people around the world. The mission? To serve and support both professional and family caregivers. And it's all because of Rosalynn Carter.
The Rosalynn Carter Institute for Caregiving just received approval for a $500,000 grant from the Administration for Community Living to teach and provide new resources for caregivers caring for someone with dementia all across the United States.
Whether it's type 2 diabetes, whether it's insulin.
Here students attend class and groups hold seminars.
And I relate that to the #1 comment on family surveys there.
It all takes place at the Rosalynn Carter Health and Human Sciences Complex and the Rosalynn Carter Institute. The former executive director of RCI shares how this has become an education, research, and service unit of the university.
Rosalynn Carter was a visionary. She was a pioneer in caregiving. She thought about caregiving before anyone else ever thought about the need for caregivers.
We've done a lot with those caring for loved ones with Alzheimer's, and we also work with the professionals that care.
So without her leadership and without her vision and without her influence, the world and our nation today would not be recognizing caregivers the way we do.
And the support and admiration of what she did not only came from her colleagues, but also from her dear friends.
I think that she has made people more aware of that. And I feel like that is a big thing for the nation.
Pope explains why Carter really knew the meaning of caregiving. She helped care for her family, including her terminally ill father, while she was still young. It can help anyone understand how her commitment turned into a passion.
Devoted to whatever she wants to do, and devoted to her family, devoted to her husband, devoted to the mental health program. She is a lovely friend. She would go the extra mile for you if she could, if she felt that you needed it.
And she has been going the extra mile since she was in the governor's mansion, all the way to the White House, and then became the founder of the Rosalynn Carter Institute for Caregivers. Mrs. Carter often noted that there are only 4 kinds of people in this world: those who have been caregivers, those who are currently caregivers, and those who will be caregivers, and then those who will need caregivers. The Carter family says they hope sharing the news about her dementia will increase important conversations at the kitchen tables and in doctors' offices across the country.
Yeah, and of course, this is an announcement that comes just a few months after we learned that former President Jimmy Carter was admitted into hospice. The family says both Mr. and Mrs. Carter continue to live happily at home, enjoying Plains and taking visits with loved ones.
Now, obviously, dementia is a condition that's like an umbrella term term, right? So there are lots of different kinds and forms of dementia that they are keeping private for Mrs. Carter, but this is something she has fought and advocated for so many years. And so I can only hope that now she will get the kind of support that she has fought for so many people over the course of her life.
I mean, we talk about for decades she's been advocating for mental health and reducing stigma, and now she's going through this fight with dementia, and even in that notice from the Carter Center saying we wanted to announce this because we want these conversations to be had at the dinner table, we want them to be had in doctors' offices, just really speaks to her legacy continuing even now.
This is brave. Making the announcement itself is brave. It's showing an example of how to age gracefully and with dignity, and of course reducing the stigma as well.
Yeah,
it's
absolutely.
amazing.
Yeah.
I mean, there's a fantastic story about how she got in line when Jimmy Carter was running for governor, and he was shaking hands with people, right? She got in line, and when she got up there, he didn't even realize it was her at first. She said, "Mr. Governor, I want to know what you're going to do when you become governor for people with mental illnesses." And he said, "I'm going to make you, I'm going to create the best, group possible and put you in charge of it." And look, he did.
Yeah.
The governor's office, White House, and now she is the founder of the Rosalynn Carter Institute for Caregivers, which has helped thousands and thousands and thousands of people.
And so many people watching, so many people in our state and our country are going through this in their own families. It is a devastating diagnosis for so many people. And to know that you're not alone and that there are people who are out there fighting for you, advocating for you, and being open about their own stories, I'm sure is a bit for them as well.
Yeah, I can speak personally to that. I went through this diagnosis with my family, and her tips and tools and resources helped my family personally. So I know her legacy is shining brightly today as she makes this brave announcement.
Yeah, we wish them absolutely all of the best.
All right, our thoughts and prayers continue to be with the Carter family. You can find all the latest updates on the Carters on our website, 11alive.com.